Monkeypox is an infectious disease caused by the monkeypox virus that can occur in certain animals, including humans. Symptoms begin with fever, headache, muscle pains, swollen lymph nodes, and feeling tired. This is followed by rash that forms, blisters, and crusts over. The time from exposure to onset of symptoms is usually 7 to 14 days. The duration of symptoms is typically 2 to 4 weeks. Cases may be severe, especially in children, pregnant women, and/or people with suppressed immune systems. Monkeypox may be spread from handling bushmeat, an animal bite or scratch, body fluids, contaminated objects, or close contact with an infected person. The virus normally circulates among certain rodents. Diagnosis can be confirmed by testing a lesion for the virus's DNA. The disease can appear similar to chickenpox. The smallpox vaccine can prevent infection with 85% effectiveness in 2019. A monkeypox vaccine, Jynneos, was approved for adults in the United States. The current standard for treatment is tecovirimat, an antiviral that is specially intended to treat infections with orthopox viruses, such as smallpox and monkeypox. Signs and symptoms of monkeypox. Early symptoms include headache, muscle pain, fever, and fatigue. The disease can initially appear similar to chickenpox, measles, and smallpox, but distinguished by the presence of swollen glands. These characteristically appear near the ear and jaw, in the neck, or in the groin before the onset of the rash. Within a few days of the fever, lesions characteristically appear on the face before appearing elsewhere, such as palms of the hands and soles of the feet in a centrifugal distribution. 3/4 of affected people have lesions on the palms and soles, more than 2/3 in the mouth, a third on the genitals, and 1 in 5 have lesions in the eyes. They begin as small flat spots before becoming small bumps, which then fill with at first clear fluid and then yellow fluid, which subsequently burst and scab over. There may be a few lesions or several thousand, sometimes merging to produce large lesions. In each part of the body affected, the lesions evolved in the same stage. It looks identical to the rash of smallpox. An affected person may remain unwell for 2 to 4 weeks. After healing, the lesions may leave pale marks before become dark. Limited person-to-person spread of infection has been reported in disease endemic areas in Africa. How causes this monkeypox? Monkeypox in both humans and animals is caused by infection with monkeypox virus, a double-stranded DNA virus in the genus Orthopox virus family Poxviridae. The virus is found mainly in tropical rainforests, regions of Central and West Africa. The virus is split into Congo Basin and West African clades, matching the geographical areas. Most human cases of monkeypox are acquired from an infected animal. Though the route of transmission remains unknown, the virus is thought to enter the body through broken skin, the respiratory tract, and the mucous membranes of the eyes, nose, or mouth. Once a human is infected, transmission to other humans is common, with family members and hospital staff at particularly high risk of infection. Human-to-human transmission is thought to occur primarily through close contact with an infected subject. There are indications that transmission is occurring during sexual intercourse. Animal-to-human transmission may occur by bite or scratch, bushmeat preparation, direct contact with body fluids or lesion material, or indirect contact with lesion material such as through contaminated bedding. Humans can be infected by an animal via a bite or by direct contact with an infected animal's bodily fluids. The virus can also spread from human to human by respiratory, that means airborne contact, or by contact with an infected person's bodily fluids. Risk factors for transmission include sharing a bed or room or using the same utensils as an infected person. An increased transmission risk is associated with factors involving the introduction of virus to the oral mucosa. Monkeypox symptoms tend to begin 5 to 21 days after infection. Further research about the transmission of the strain responsible for the 2022 outbreak is ongoing, but it is not thought to be different to other strains of the West African cold. So, what is the diagnosis of monkeypox? Clinical differential diagnosis must consider with rashness such as chickenpox, measles, bacterial skin infections, scabies, syphilis, and medication-associated allergies. Lymphadenopathy during the prodromal stage of illness can distinguish monkeypox from chickenpox or smallpox. Diagnosis can be verified by testing for the virus. Polymerase chain reaction (PCR) testing of samples from skin lesions is the preferred laboratory test. PCR blood tests are usually inconclusive because the virus doesn't remain very long in the blood. To interpret test results, information is required on date of onset of fever, date of onset of rash, date of specimen collection, current stage of rash, and patient age. How can you prevent monkeypox? Vaccination against smallpox is assumed to provide protection against human monkeypox infection because they are closely related viruses, and the vaccine protects animals from experimental lethal monkeypox challenges. This has not been conclusively demonstrated in humans because routine smallpox vaccination was discontinued following the eradication of smallpox. Smallpox vaccine has been reported to reduce the risk of monkeypox among previously vaccinated persons in Africa. The decrease in immunity to pox viruses in exposed populations in a factor in the prevalence of monkeypox. It is attributed both to warning cross-protective immunity among those vaccinated before 1980, when mass smallpox vaccinations were discontinued, and to the gradually increasing proportion of unvaccinated individuals. The United States Centers for Disease Control and Prevention, that means CDC, recommends that persons investigating monkeypox outbreaks and involved in caring for infected individuals or animals should receive a smallpox vaccination to protect against monkeypox. Persons who have had close or intimate contact with individuals or animals confirmed to have monkeypox should also be vaccinated. The CDC doesn't recommend pre-exposure vaccination for unexposed veterinarians, veterinary staff, or animal control officers unless such persons are involved in field investigations. The CDC recommends that healthcare providers don a full set of personal protective equipment (PPE) before caring for an infected person. This includes a gown, mask, goggles, and a filtering disposable respiratory mask, that means N95. An infected person should be isolated in, preferably, a negative air pressure room or at least a private exam room to keep others from possible contact. What is the treatment against monkeypox? In the European Union and the United States, tecovirimat is approved for the treatment of several pox viruses, including monkeypox. Best practice recommends tecovirimat or the smallpox treatment, brincidofovir, as the first-line antiviral treatment if required, alongside supportive care including antibiotic fluid balance and oxygenation, empirical antibiotic therapy, or acyclovir may be used if secondary bacterial or or varicella zoster infection is suspected, respectively. Thank you very much. See you again with a new video. Bye from this moment.